So as of this morning, September 13th, we have a total of 310 lab-confirmed cases connected to the outbreak. There are currently 21 patients receiving care, all of whom are currently children. There are 14 patients who have been discharged from hospital since the beginning of the outbreak. There are 20 patients confirmed as having hemolytic uremic syndrome, including 7 patients on dialysis. There have been 18 secondary transmissions, all within households linked to the outbreak. This is heartening and shows that our quick response and communication with families have helped to limit that spread.
As some of you may be aware, the closure orders have now been rescinded for all 11 daycare facilities. That means the daycares may reopen at the discretion of the operators. I want to stress that the closure orders were rescinded only after Alberta Health Services determined the facilities are safe environments for children and the staff. Our AHS inspectors visited all 11 daycares to review conditions in each facility and ensure they met requirements for safe operation under the Public Health Act. These inspections are thorough and highly detailed. Having been on some of these myself, I can tell you they take several hours, and the inspectors will go through every room, every operating procedure to assess the conditions found and ensure that they are compliant against those stipulated in legislation. These daycares have addressed any immediate risks found and have met all requirements under the Public Health Act related to sanitation, and safe operations of each facility were met. While the daycare facilities have had their closure orders rescinded, the central kitchen that provides food to the daycare remains closed at this time. Our investigation into the source of the illness continues. We have not identified a food source at this point. However, as we have noted before, the epidemiology of cases we have seen to date strongly indicates that it is likely the source of the outbreak is food that was distributed from the central kitchen.
It can be frightening to see these numbers, especially jump in the last few days. And a lot of that has to do with process. So those that were symptomatic or affected, we saw early on and picked up coming through various emergency departments and had those numbers. As public health required testing of all children in the daycare and household contacts, we anticipated that there would be an increase in numbers who may be what's called asymptomatic, so may test positive and not have symptoms. And so this increase in numbers we're seeing has more to do when we're getting results from the lab on those tested previously, but actually clinically in the emerge, we're seeing significant decrease in the number of children presenting with illness.